Good morning-ish, I guess. I just realized it's 11 o'clock, my time anyway. So I've been watching the COVID-19 updates in my area. On Wednesday, which was just 3 days ago, we had 26 confirmed cases of COVID-19 in Kansas City. As of today, we have 73. So the numbers are just doubling and jumping. It's ridiculous. At 8:50 last night, they confirmed 73 cases. It's crazy out there. I actually ventured out for the first time this morning. I went to a local gas station that we have here in Kansas City. It's called Quick Trip. I don't know if any of you have those in your area or not, but I could not believe what I saw when I walked in. They have their soda machines shut down and their coffee pots shut down and no cups for people to touch. I mean, it's crazy. I'm glad to see that they're erring on the side of caution, but it's insane. The things that I'm seeing now that I'm able to venture out in public. I spent most of my day yesterday sleeping and trying to catch up on my rest and just enjoying being at home. I went to the store today and the shelves are just empty. There's no milk, there's no bread, there's no eggs, there's no toilet paper. It's insane. I have never seen anything quite this bad. Thank you, Red. Absolutely. We are staying, at least in my facility, we are staying as safe as possible. We wear our PPEs, we wear our N95s. We're doing everything that we can to keep our nurses and our doctors and our healthcare workers safe. Um, it's crazy because like now that I'm seeing what's going on the outside, the people that people make fun of, as far as like your gas station workers or your fast food workers or even your Walmart greeters or your Dollar General store employees. These guys are still getting up and going to work every day so that people who need things, they're there so that you can get them. So the next time that you want to make fun of someone who works in a Walmart or in a Dollar General or at a gas station or even in a fast food restaurant, um, can they're there. They are still going to work every day. So it's just amazing to me to think about the small things that I've never really thought about. People are texting me. They're wanting to come and see me, but I can't. I can't see anybody right now. I'm kind of bored here at home. I appreciate the fact that I'm here, but it's a lonely world. I got up this morning and I thought, well, I guess I'll just deep clean the house. I have nothing better to do, so I started stripping beds and wiping baseboards and you know this Lysol and everything and alcohol wiping everything and trying to make it to where when my kids get to come home Monday morning, because I'll be back at work, when my kids get to come home Monday morning, the house is sanitized and I don't have to worry about them. uh, it just sucks. It really sucks because I had 3 days home and I don't even get to spend it with the people that I love and the people that I care about. I had to literally quarantine myself at home. I do have an N95 that I'm able to wear when I go out in public, and I'm required to wear it when I go out into public. I cannot take the chance of contracting anything and then going back to work and infecting others. So it is what it is. I know that come Monday, um, I'll be back, on the front line, and I won't have another day off until I don't even know when. You know, this COVID-19 is really out of control, and it doesn't seem like there's an end anytime soon. You can probably hear Max in the background barking. It's so quiet around here that they bark at any little noise they hear. So, how to keep yourself safe? The best thing I can tell you to do is wash your hands. This is a virus. It is a virus. It is not an infection. Viruses live on surfaces. So every time you touch something, there could potentially be a virus on it, and you need to wash your hands and do not touch your face. People think that this is crazy to tell people not to touch your face, but honestly, the portal of entry for a virus in your body is going to be your mouth or your nose. People do not realize that they touch their face at least 40 times an hour subconsciously, whether if it's rubbing your eyes or scratching your face or rubbing your nose, or wiping the corners of your mouth. You touch your face at least 40 times an hour subconsciously. So it's important to keep your hands clean. Soap and water, just regular soap and water, wash all the way up to your elbows. If you have to cough, if you have to sneeze, do it in the bend of your elbow. Do it in the bend of your elbow. Wash your hands all the way up to your elbows. Do not touch the surface of the sink in which you're touching or in which you're washing your hands. Keep your hands elevated. Wash up to your elbows. Wash for at least 20 seconds. Sing your ABCs. Pick your favorite song. It doesn't matter. Just, scrub vigorously. When you turn off the faucet, put a barrier between your hand and that faucet. Your faucet is a surface. Get a paper towel. Use a paper towel to turn your faucet off. If you have to touch a doorknob, use a paper towel. Put a barrier between your hand and that doorknob. There are things that you can do to keep yourself safe at home and safe in public. The social distancing, we're telling people to social distance 3 to 6 feet from another person. That's because this virus, it is not airborne. And I have seen so much stuff on social media talking about how coronavirus is airborne. That's not true. That is not true. It is droplet. It is droplet precautions. People who are coughing, people who are sneezing, people who may spit when they talk, those are droplets. In order for a virus to be airborne, it has to be able to live in the pathogens that we breathe in our air. Or it has to be contained in a droplet large enough like rain. This is not an airborne virus. There are so many misconceptions right now about COVID-19 that people are terrified. And I understand people are terrified. I get it. This is something that we've never seen here before. It's something that seems to be like it's spreading rampantly. I was looking last night on the live cam of Bourbon Street, and I could not believe on a Friday night there was nobody on Bourbon Street. Not one single soul on Bourbon Street. And then I sat there and thought about like all the businesses that are in the French Quarter and the bartenders and the waitresses and the people that work in the Quarter and how this is really affecting their life right now. There's no money being made. There's no money being paid. It's terrible. And our economy is going to suffer greatly for this. So it's taking its toll on everybody, not just the people that are still getting up and going to work every day, but it's really taking a toll on those that can't get up and go to work every day. And then I saw people saying, pull your money from the banks. Well, that's silly. That's silly. Because think about it, guys. Even if you have money in your pocket or money in the bank and you go to buy a loaf of bread, how are you going to buy a loaf of bread if there's no bread to be bought? How are you going to buy a gallon of milk if there's no milk to be purchased? Having money right now is not the deal. It's having the products to be able to use your money to buy. I guess I'm lucky as far as the eggs go because I do have some chickens. I do have some chickens. But, I'm not an egg eater, but my kids are. So I don't know. People, trolls would like make fun of me telling me that I milk cows. I wish I had a cow to milk right now. Do you know, do you know how bad I wish I had a cow I could go outside and milk right now? It's crazy. This is going to be the time when we're really going to learn how to be resourceful. I don't really get all the buying of the toilet paper. This is a respiratory virus. It's not something that causes diarrhea. And why people think they're going to be sitting at home wiping their ass for the next couple of weeks is beyond me. The only people that we are really seeing that are being affected detrimentally over this virus are people in the age group 60 and above. people with underlying health conditions, people with weakened immune systems, people with heart disease, with lung disease, with COPD, people with diabetes, people who already have organs that are not working properly because the virus is attacking organs that are already systematically failing. If you are a normal, healthy adult, they're making full recoveries. People seem to think that children are immune to this. That's not true. No one is immune to this virus. Adults and children alike are all susceptible to catching COVID-19. It's just a matter in how healthy we are to how we recover. We're telling people stop going to the emergency rooms. There is nothing that can be done for you in an emergency room. People getting tested for COVID-19 is not as easy as what you may think that it is. It is a series of tests that are performed. The first thing you are going to be tested for is the flu. If your flu comes back negative, you'll have a what's called an RPP test, which is a respiratory pathogen panel. It takes 3 to 5 days to even get the results of the RPP. If your RPP is negative, then you can be tested for COVID-19. It's not as simple as people think. It's not something that we can just go and swab in your nose and say if you're positive or negative. It is not that simple. So there's no point in coming to the emergency room. There's nothing that can be done for you. We are telling people stay at home. Isolate yourself. Keep yourself away from your family, from your loved ones, from your children, from your elderly family members. Stay away from them. Isolate yourself. You can only treat the symptoms of a virus. You cannot treat the virus. Therefore, if you have a cough, Robitussin, Mucinex, NyQuil, Dayquil. If you have a fever, you can piggyback Tylenol and Motrin for your fever. Stay hydrated. That is the most important thing, is to stay hydrated. When you have a fever, your body is literally burning your hydration system. Water, water, water. Drink lots of water. Get lots of rest. The only time that you should ever go to the emergency room is if you are having difficulty breathing. But for a fever, for a cough, for a sore throat, that is not a reason to come to the emergency room. There are things that you can do at home. Also, I don't know if in your location, if it still gets cold at night, but when you're having difficulty breathing, cold air helps. Open up a window. Go sit outside. Cold air dilates the bronchial tubes. So there are things that you can do at home that we cannot do for you in a hospital. Also, when you go rushing to the emergency room, you are taking the risk of spreading the virus. Wash your hands. Think about what you are doing. Use common sense and be smart. That is the best advice that I can give anyone, is just use common sense. Be smart. Wash your hands. Try not to touch your face. If you have to touch your face, wash your hands before you do it. If you are not anywhere around where you have or if you don't have soap and water available, use an alcohol-based hand sanitizer with 60% or more alcohol. People are saying that the blood type A is more likely to contract coronavirus. Well, that's not 100% true at this time. While scientists are linking the blood type of A to coronavirus, it has not been confirmed. And the only reason why they're saying that right now is because primarily most of the people in China who contracted coronavirus were blood type A. But you have to think that A blood type is one of the most common blood types of the world. People are saying that heat kills the virus. That has not yet been proven. You have to be very careful of what you are listening to in social media. The best way to protect yourself, protect your family, is hand washing. Stay away from people who are having a chronic cough. Stay away from people with the fever. If you have a fever, you shouldn't be out in public anyway. When you have a fever, that is the most likely time that you are contagious. Signs and symptoms that we are seeing of COVID-19 are fever greater than 100.4, a sore throat, a cough, and shortness of air. It is a respiratory illness. It's a respiratory virus. But we cannot treat the virus. We can only treat your symptoms. And therefore, you can treat your symptoms isolated at home. Because the things that I am telling you right now are all the things that we're going to be able to do for you. So don't be stupid. Don't take the risk. Don't infect others. Treat your symptoms. That's all you can do. Everybody knows that a virus has to run its course. The number of cases are climbing because people are not heeding warning. They're not taking it serious. They're not doing what we're telling them to do. So, anyways, I guess I'm just going to get back to my deep cleaning. Right now, honestly, you guys, I think that roasting people is stupid right now. Um, this is not the time. This is not the time in our communities. This is not the time in our country to be roasting anybody. I think that right now people just need to stay safe. They need to stay more focused on what's important, and that is, not contracting this virus and passing it on to your loved ones. I think that there is so much that we could be doing with our time right now than sitting on YouTube and roasting each other. So I'm not, although I have quite a bit to say about a couple of people, I'm not mentally there. I'm not mentally in a roasting frame of mind. I'm more in the frame of mind of keeping my family, keeping myself, and keeping my children safe. I believe there's a time and a place for everything, and this is just not the time for roasting. We are all at risk. Every single one of us are at risk. There is nobody safe. Pine needle tea. Curie, I've heard that pine needle tea is really good for a lot of things. Green tea also. Green tea helps with your energy, it helps with your immune system. You know, whatever herbal remedies that you choose to do to boost your immune system, now's the time to do it. Just keep yourself safe, guys. That's my main priority right now is keeping myself safe, keeping my family and my children safe. And, when I get back to work on Monday morning, it's going to be protecting those that I can protect at work. So all of you stay safe, uh, do what they're telling you to do. Take this seriously and enjoy the rest of your weekend.